Welcome to this video, and thank you for your interest in the RSE's work on the role of data, evidence and science during the COVID pandemic. The picture I'm going to talk you through was the output from a group discussion with some of the experts who have been, and still are, advising governments in Westminster and Holyrood, and also advising all of us through interviews with the media. While the points made are not attributable to individuals, we did want to share some of the insights and chose to use an illustrator who captured the words and turned them into pictures. Now, this is a very complex diagram, and so I'm going to talk you through some parts of it, although the full diagram is available on the website. Let me start by looking at the complexity. So, very complex structures were set up to advise government. Were these necessary? Well, yes, absolutely. COVID had an impact on all aspects of our lives. And so the UK government and the devolved administrations called not just on scientists working in the health sector, but also on behavioural scientists, environmentalists, economists, many types of social scientists, to be able to give them advice on how COVID would have an impact in all these different ways. Impact is a key word, and our experts told us that one of the first questions they asked after having spent initial time feeding into government, were they having any impact? Of course, everyone likes to know that they're having an influence, and they were reassured that yes, they were. It maybe wasn't immediately obvious, case numbers still went up, hospitalisations. But of course, they couldn't see what would have happened if the government hadn't relied on data, evidence and science to advise it in terms of its decisions. But of course, it wasn't only through advisory groups that these experts were having an input. They were also invited to give evidence to select committees. These are committees of the two houses of Parliament, the Lords and the Commons, and they're cross-party members of those committees, and it's a way by which they can learn the same sort of advice that is going to government and enable them to challenge government in Parliament in terms of the decisions made. Our experts were also giving advice through interviews on the television and through other media channels. By looking at the public reaction to that advice, then government could start to combine the advice, the public reaction, and decide on the decisions that they would make on the way forward. One example where science had helped to develop treatments that would be very useful in terms of COVID for patients in hospital, but there was a very clear focus on vaccines, and it was difficult for people promoting those treatments to actually get a voice at the table. But of course, science is not an absolute. Different scientists have different interpretations, but scientists don't always agree. And the media brought that to the fore by reporting different scientists supporting different pathways. But science has always been about building consensus. That's part of the scientific process. And we agreed in the group that we needed to do more to help politicians and the public understand this, and this was the way forward. But the press also tried to get scientists to be advocates of specific activities, specific pathways, decisions that might be taken. And indeed, I'm sure that many of us sat in our armchairs and looked at the television and said, no, this is the way it should be going. So what we need to be clear about is that advice very much came supported by evidence, and that is the role of academies like the Royal Society of Edinburgh. This group is a subgroup of the RSE's Post-COVID-19 Futures Commission, and it is important that we learn lessons. We came up with some suggestions which still need to be tested more widely. The suggestions we made include individual experts accepting a responsibility for reaching out to their wider networks, and the RSE playing a role in ensuring that the work of building more trust between politicians and experts and engaging the public in discussions on data evidence science continues between crises to build on the trust established during COVID so that we are prepared for future crises when they come. Thank you for listening.